And now to contrast that, we're going to go look at a very different county and a different approach from San Bernardino County with their day reporting centers. And joining us today is Julie Hovis, who's with the Probation Department Division Director, and Veronica Kelley, who's Deputy Director of San Bernardino County Department of Behavioral Health. So, come on up, if you'd like.
Can you hear us? Okay. Do you mind if we sit? Thank you. Okay, so my name is Veronica, and so I'm going to start just to give you some background on how we all got to this place. So our Community Corrections Partnership met just like every other counties did. It was surprisingly very professional. There wasn't a lot of grabbing for funding. What there was a focus on the fact that we all were working with the same folks. This was a jigsaw puzzle we've been working on for decades. The issue was that each of us were working on pieces of this puzzle in our own departments. So probation's working on the top corner in the probation office. DBH, the Department of Behavioral Health, was working on the middle portion in our office, and we could never make the whole thing whole. So the CCP process allowed us all to actually get in the same room and work on the puzzle. And actually all of our pieces fit. So aside from the folks who were required to be present as part of the process, we also had our director for the Department of Behavioral Health, who at the time was also the director for public health. And that's Alan Rolland, who many of you know. And he's a very well-known, respected man who has a very strong voice, but who's very diplomatic. So he was able to, from the beginning, talk about the need to make sure that we address the behavioral health needs, which include mental health and drug abuse needs, as well as the public health needs, the workforce needs, all the needs of the reentry folks. We also had workforce development department at the table. Our transitional assistance director was present, and that's our social services department. And then we called on our director of aging and adult services. That's where our APS, our Adult Protective Services, is located, as well as our Mexican consulate. Our population in our county is about 2.1 million people, but we are 21,000 square miles of county. We're the largest county in the contiguous United States, and we're both urban, rural, and frontier. So that gives us a lot of issues, especially when we're looking at the folks coming back to us. We have folks who come back to Victorville and Barstow that are geographically isolated, as well as to our cities in San Bernardino and Ontario, Rancho Cucamonga area. So we all got together and developed the idea of how the day reporting centers would come about, that we needed to locate them where folks were coming back to, and that they needed to be one stop. Because it's hard enough for any of us to go to the doctor's office and then be given an order and then go get your x-ray across town and then go to the pharmacy. These folks don't have all the skills we have. They have different skills, and we didn't really want them to focus on those different skills. We wanted to give them everything right now while they needed it. So that's how we all got together and started the idea of we're going to do the day reporting centers ourselves. We're not going to contract it out. We're going to keep it all in the county. And then that's when Julie was given her orders. So do you want to?
As Veronica said, all these different departments within the county were dealing with the same clients. So we said, let's do it all in one spot. And that's where we came with our day reporting centers. We also had done a little pilot project called SB 678 about 2 years before, in which case we trained probation officers to start doing some different things. They started doing cognitive groups, which is something normally you would refer out in the community. And we found that the POs started developing relationships with the clients, and that led to increased success. So we brought some of those folks over to our day reporting centers. So we have different agencies providing services, probation is providing services. But the one thing that's great is we're all in the same building, so we are talking to each other. So when somebody goes over and sees DBH, and DBH comes to probation and says, hey, I think you've got this issue with this person. This is what we see. Probation says, okay, and then maybe we go over and we talk to TAD and say, okay, we've got some immediate needs for medical. Can you help us with this? We work with workforce development, and we can say, look, we know this person's been testing clean. We've been testing them. Let's get them into some employment and get them set up for some job interviews. And that works really great with the employers because you've got probation saying, this person's clean. We're staying on top of them. So they're more likely to hire them. So it's been a win-win, I think, for everybody. One of the initial challenges we had to overcome was the communication between the departments, because everybody has their confidentiality they have to maintain. And it's how are we going to get past that, and how are we going to work with that to be able to meet the needs of the clients. So that was one thing we really had to work on up front at first.
So the way it works is, at the Day Reporting Center, the AB 109ers report there for orientation with their PO. They do their individual orientation, the PO walks them to our behavioral health staff. So each Day Reporting Center has all their probation officers, and then they each have a social worker and an alcohol and drug counselor, and those are DBH staff. We also have workforce development on site, and then we make appointments and have public health doc and nurse come out on certain days. We had initially been sending the public health folk, or if you had a communicable disease issue or some type of medical issue, out to our public health clinics. But if you think about who's at our public health clinics normally, it's moms and kids. So it didn't really, we had a few complaints. So we changed that up, which has been the effective part is we have great communication. If it doesn't work, we change it. So the PO walks the client over after they've done their orientation to us, and we screen them. We screen every probationer who comes in. So we have 2 staff who do that, and they use the same screening tool that the CCP subcommittee created. It has workforce development issues on it. It has public health issues, financial issues. We attempt to address every domain of the client's, of the probationer's life. And they also get a mental health screen and a substance use screen in this one, it's a 1.5-page document. So immediately while we have them there, we ask them, would you like these services? And they're usually amenable. We only have a 2% refusal rate for our referrals. That's pretty good to even come see us. So and what we've noticed is a few weeks after, sometimes the probationer returns and says, I think I do need that anger management class. But we do that in conjunction with probation. Sometimes they are the muscle to get us to move folks forward in their recovery, and that's been very effective. We offer on-site educational classes, which include understanding addiction, phases of recovery from co-occurring disorders, problem solving, communication. So we do psychoeducation on-site, and if they need higher levels of care, then we refer them out, and we do that as a warm handoff. So we might give them the bus pass, or we might have a facility come and get them. In particular, if they're an alcohol and drug person, if they're open to recovery at that moment, we've got to get them to recovery in that moment. And we've prepared a handout, I hope you all got it in the back, that's just our annual report to show you who we've seen and what we've seen. We've screened about 1,000, since our Day Reporting Centers opened in June, we've screened about 1,000 folks. So again, 98% have been amenable to the screening. Of that, we've referred about 160 for alcohol and drug programs and about 140 for mental health. On top of the AB 109ers who we see at the DRC, we have another population called the EOPs, the Enhanced Outpatient Program folks. Those are folks in prison who are in separated program getting their mental health issues attended to, so they're not in general population. They are higher severity because of their mental illness. So those folks we get in addition to these regular ones. And the way that works is that we have a central point of contact, a forensic case manager in DBH. She gets the call from the correctional facility. We work directly with probation to make sure that we get that person their medication, that it gets filled, that they get a place at a room and board or board and care, depending on what kind of care they need, and that we get them hooked up with treatment, outpatient mental health treatment. We do that immediately. Prior to our DRCs, we had 112 EOPs from October 11th until June, 112. We have 90 that we received in the last 3 months, and we case manage about 68 of those, meaning it's not just probation who has a set of eyes on it, we have a set of eyes on them too, as does public health and workforce development, and then we all get together and talk. So that, I think that's been really effective as well. With our drug and alcohol folks, we've had since prior to our DRCs being open, we had folks just self-refer, or POs would refer them informally. 55 folks went to treatment, 30 of those were in residential, and the others went to outpatient. And we looked at the success rate of the program. We use an evidence-based program called Matrix, which is an alcohol and drug program. 16 weeks of program, they come in 2 times a week, they do the work, and then they urine screen randomly 2 times a month. The state success rate for that is 20%. And our AB 109er success rate was 30%. So we know there's something there. So what we've seen now, and you have the numbers in your report, are since June, how many folks have gone through into alcohol and drug residential, outpatient treatment. Interesting, we have 6 folks who are in perinatal programs. So those are moms who are pregnant or parenting and on drugs. That's great that we have those folk in perinatal programs. They're also, we know, connected with our Children and Family Services for reunification. It's working. We all are talking all the time. We also have 6 who are in our narcotic treatments program. So that's our methadone treatment center. Way better that they're in our methadone treatment program, getting treatment rather than on the street using heroin. So we've seen it, and we're just starting. Again, our day reporting centers have only been up since June, but we are really just seeing this, and it's very, very exciting.
One of the things we did was we incorporated all that screening into when the inmates are first released to us, and we do our orientation and assessment. And what we found is that if we ask them, do you want assistance, they tell us no. If we say you're going to get some assistance, they go, okay, great, where do I go? And their attitude changes. So one of the things that's helped us in our success is by not making it optional and requiring it. We also have faced the challenges of finding communities that are welcoming us into their communities with these DRCs. We turned one of our juvenile halls that we had downsized and closed into a day reporting center. So that was great because we had total control. We're right across the street from the jail, so they don't get lost coming to us. In Victorville, we had a building picked out that was 2 blocks from the parole department. And the city told us we were violating zoning and we could not go into that building. And we said, but parole's 2 blocks down. Well, we don't want that clientele there. Parole's 2 blocks down. You already have these people. So it has been a challenge for us to find a location. And as we get into the buildings, we're quickly outgrowing them because we're bringing more and more people in. We have an educational component that we will be bringing people in to do GED providers. In San Bernardino, we hope to be into our permanent building in February, in which case we're working with First Five to come in and do some services and some daycare so we can remove that barrier of childcare to get offenders in so we can provide some services. We've also are still working, and I saw Matt Cates in the back, but what we discovered is probation is there are many things that parole officers could do that when the law changed, they didn't give that power and authority to probation officers. For instance, a parole officer can write a letter to the DMV saying that this person is who they say they are, and the DMV will take that and give them an ID, but probation can't do that. So it's one of the things we're working on fixing, and it's just little things like that that we've been challenged with. We talked about our success rate, which is unbelievable. Only 22% of offenders are getting rearrested, and in San Bernardino County, the average was higher than the state. It was up in the 80s. And that's not because we're giving people free passes. One of the things, in addition to our day reporting centers we did, was station 25 probation officers directly at PDs. So those officers are working with the police agencies and the sheriff's agencies to analyze crime trends, to be proactive in dealing with offenders. They actually see probably more about what the needs are in the community, and they come back to us at the day reporting centers and let us know so that we can modify services or we can add services. Because as Veronica said, we've got Barstow, which is very rural, very frontier, and we have San Bernardino, which is huge. And the needs in the 2 areas are very different. One of the things that San Bernardino did also is we put aside a pot of money that we're using for bus passes, incentive cards. We've had some offenders who've gotten jobs but need steel-toed boots and don't have the money to buy the boots. We're buying the boots for them. So we have that pot of money too that we're using to help offenders.
We also are looking long-term, so we are getting all of our day reporting centers certified for Medi-Cal certified. Because when we have our EOP folks, those higher level mentally ill folks coming out, they'll get back their benefits. The majority will. Now, we know that a lot of our drug felons aren't going to get Medi-Cal, but they get LIP, which is our low-income health plan. So we need to get things ready for the future. We also have one of our day reporting centers certified as an alcohol and drug treatment center. We're in the process right now of getting that certified. Our big packets went up 2 weeks ago. That way we can provide services right there. That is a little bit more difficult than it sounds because you have to have certain facility issues met. So you have to have a restroom dedicated just for urine screening. So when we're looking at the DRCs, we're always asking, is there an extra bathroom? It's very exciting for us because then we can do treatment right there. Our on-site drug and alcohol program is going to be patterned after one of our hybrid drug court programs. That's for the higher level folks who aren't successful anywhere else, and that's been our most successful drug court program. So we're anticipating we're going to get the very same. When we were talking about, when Julie was talking about some challenges, it sounds really great, but we have had additional challenges, and especially with our EOP population, our enhanced outpatient prison folks coming back who have a mental illness. In the last month, we've gotten about half a dozen who are over 65, who are in their past sex offenders, in their not too recent past arsonists, and also have dementia. And that's not a mental illness that we treat, but we have to place them. And to find a skilled nursing facility that will take a sex offender arsonist is an issue. But we've been successful. We have our providers in the community step up, our faith-based organizations are stepping up, and we have a couple of facilities that are out in our rural areas that are able to, away from the forest, that are able to address those folks. And again, if we weren't all able to get together and talk and communicate the way we do, this would never have happened. So in many ways, AB 109 and public safety realignment is a boon for our county.
Thank you. Great stories.